I'm Laura Pierce, and I'm treasurer at NAMI Chattanooga. I've been with NAMI for about 3.5 years now. Prior to that, I was in public accounting for a long time, and as you can imagine, I was very much into planning and having my life go a certain way. And then my son began to exhibit some symptoms of mental illness, and we took a step back and kind of changed things. The world of mental illness it's complicated, and so it took a lot of learning and digging to try to figure out how to answer some questions and to adjust and to pivot, I guess, if you will. But through NAMI, I was able to help do that. Part of that was by the support groups. That was probably the first experience that I had with NAMI here, and I thought I was doing something completely different than everybody else had. And when I told my experience, there were 15 people in the room who had had many of the similar experiences, and it was the first time since this had begun to happen that I really no longer felt alone and was able to speak freely about how it affected my son, how it affected me, our marriage, our friendships with other people. And it just was a really great space to feel that freedom that I hadn't been able to find really anywhere else. In addition to that, I think Cheryl and Kathy both talked about how NAMI could teach us to advocate for our sons and for ourselves. One of the things that we've been able to do is to talk with some of the crisis intervention teams. Those are policemen. That are trained to help in situations where someone's in a mental health crisis. And so they invite us to come speak at their trainings and provide the family perspective. It's something, unfortunately, that a lot of us have to learn how to do and how to call when we need help and witness, but there's so much that we've been able to share with them. My son's spoken about, he remembers when he has these incidents, and he's spoken about how things made him feel, taking time to slow down and really sit and talk with him and treat him as you would anyone else who was in a crisis. That really helps, and finding that they care about you is very, very helpful, and just kind of slowing down, finding commonality, all those things help him when he's in a crisis to feel more comfortable and more willing to get some help. So those are things, but for NAMI and the education and help in dealing with my son and dealing with others, I probably wouldn't have known how to tackle. So it also helps us. I know when he was first diagnosed, he lived in California, and one of the people in his house had a bipolar diagnosis as well. And I can't tell you how gracious these people were when I came there and he was in crisis. They helped me so much, and I wanted to do something back to them, for them, because they couldn't have been kinder. And BJ was the guy's name, and he said, pay it forward, do it to someone else. That's what was done to my parents, and this is your chance. So I've loved getting to work with NAMI to help try to give back a little of what was given so freely to me.